Madagascar is the fourth largest island in the world and is situated off the east coast of Africa. It is home to 22 million people with a rapidly expanding population. Most notably, Madagascar is rightly known for its wildlife, as over 70% of all its plant and animal life can be found nowhere else in the world. Most well known, of course, are the lemurs, a species older than monkeys, estimated to be around 40 to 50 million years old. In contrast to the staggering riches of its flora and fauna is the current state of its economy. Over the past 40 years, Madagascar has been struggling, like many countries in sub-Saharan Africa. In July of 2012, Optin, the Overseas Partnership and Training Initiative, in conjunction with Leeds Teaching Hospitals, returned to Madagascar for the 7th time in the last few years. This is part of its commitment to the training of health professionals in developing countries. Optin's aim is to leave a legacy behind by furthering the education of healthcare professionals. In Madagascar, Optin has focused on the areas of ophthalmology, rehabilitation and nursing. Optin began in 2000, set up as a registered charity inside the Leeds Teaching Hospitals Trust, run by senior doctors. The aim is to transfer health service skills to a few chosen developing countries. This is done by delivering short training courses and complemented by visits from the staff being taught to the UK. Since 2000, Optin has delivered programs of education in Bangladesh, Swaziland, Uganda and Madagascar. The health professionals from the UK that volunteer to deliver these training courses usually give their annual leave and they are unpaid. Without their generosity, Optin could not deliver its aims. The first visits to Madagascar delivered ophthalmic training and were run by Mr. Oliver Backhouse. Having spent a year living in Madagascar, Oliver Backhouse set up a charity called MOS, the Madagascar Organisation for Saving Sight. He continues this work with Optin. Both charities work within the Vision 2020 agenda for developing countries. Vision 2020 is a global initiative for the elimination of avoidable blindness, a joint program with the World Health Organization. Cataract treatment surgery for adults and children is not expensive, but is very effective. There are many children with cataracts in Madagascar, and sight can be restored with the surgery. The nursing aspect of Optin's work is just beginning in Madagascar. Again, teaching basic infection and prevention control is cheap, fast and effective. The current infection rate in Madagascar is up to 1 in 4 after surgery. Hospital wards may not have hot water, so that proper hand washing and infection control assumes even greater importance than in the UK. This documented visit to Madagascar chiefly concerns the rehabilitation aspect of Optin's work. The basic function of rehabilitation is to help a person who has suffered physical impairment or trauma to return, where possible, to a more normal life, to enable children to get to school and adults to access work. It is about improving the integration of the disabled person in life. With good modern rehabilitation, this can often be achieved. The patient's impairment could be as a result of conditions such as amputation, stroke, cerebral palsy or disease. Clubfoot and rickets are still seen in children, conditions which would be treated early and effectively in the UK. The training on this visit was conducted in the hospital in Mahajanga on the northwest of Madagascar. Running the visits in different hospitals across Madagascar allows the local doctors and physios to demonstrate to their colleagues and those who run the hospitals that they are involved in a high level of training and have international visitors who are investing in them. The rehabilitation program has been devised in conjunction with the Ministry of Health in Madagascar, the University Hospital of Antananarivo, and the University of Antananarivo. It is led by Professor Anne Chamberlain from the UK and Dr. Sonia Andriana Bella Randriana Risoa of the Madagascar Ministry of Health. This program will lead to an examined diploma from the University of Antananarivo.
Sonia, where do you think we are after a year of teaching?
Alors, après un an, nous avons quand même déjà avancé malgré tout, car ce qui est très bien dans ces sessions de formation, ce ne sont pas que des formations théoriques. On peut percevoir déjà des changements dans la pratique des médecins et des kinésithérapeutes en fait. Pour la pérennisation, je pense que il faut que nous grossissions déjà l'équipe de réadaptation, puisque, comme je vous l'ai dit, nous n'avons que des kinésithérapeutes et des techniciens en appareillage. Donc on voudrait aussi gonfler l'équipe avec des ergothérapeutes, avec des orthophonistes, pouvoir pérenniser aussi cette formation de médecins de réadaptation, parce qu'on n'a que 8 médecins pour l'instant, alors que Madagascar est très, très vaste.
Optin brought with them on this trip a laptop to give to the rehabilitation centre. It is presented here to Dr. Bodo, the head of the rehab centre at Mahajanga. This is the first and only computer the department has. The teams being taught consist of a doctor and a physio from rehab centres from 9 different hospitals across Madagascar. Upon their return to their respective hospitals, the staff can share the teaching with their colleagues. They have now been learning together for several years, so they are beginning to form a group, which we hope will lead the country in furthering education in rehab for the good of patients all over the island. The doctors and physios of Madagascar have huge obstacles to contend with. The amount of the gross domestic product of Madagascar that goes towards the health service is very small. Clinical staff get almost no continuing education from qualification to retirement. Some of the staff give their thoughts about the new group that has been formed as a result of this course and whether it could lead to a more promising future for rehab medicine in Madagascar.
Donc, les connaissances que nous aurons ici seront très utiles pour la promotion des services de rééducation des fonctionnels et appareillages dans toutes les régions de Madagascar.
Je pense que c'est bien de rester en contact avec les médecins et les kinés, parce que comme ça, on formera une groupe. En cas de problème ou de difficulté, on peut partager et communiquer.
In recent years, the people of Madagascar have found daily life increasingly difficult. The resources for healthcare are declining with the economic situation. Right now, many of the country's children are undernourished. Many hospitals have no hot water, and the World Health Organization estimates the average daily wage to be €1. Like ophthalmology and nursing care, modern rehab can be taught and administered with only a modest need for expensive equipment or drugs. Therefore, it is possible for these particular disciplines to function at a high level in spite of the surroundings. However, we know that it's not realistic to think that even a 3-year course with 6 weeks of teaching each year will produce sustained improvement. So more opt-in courses are being devised, and the charity will always need volunteers, practical help, and funding to continue its work. Finally, some of the medical staff from the UK who travelled with opt-in on previous trips share their thoughts about the experiences they had.
I had the most inspiring week, I have to say. I was very humbled by the whole experience.
One thing I gained was a perspective on how to manage when resources are extremely limited. We sometimes complain about limited resources here in the UK, but it's not a patch on the limited resources that clinicians face in Madagascar.
I perceive the greatest need to be there, that they need to be able to clinically reason and not just use techniques A, B and C on patients A, B and C, but that actually you need to assess each patient as an individual and then tailor the treatment according to what that patient needs.
If I